Hi, I'm Drrodrohrich, RohrichKnose podcast from the Plastic Surgery Channel. And guess who I have with me tonight? The originator, the guy who thought up the Plastic Surgery Channel, Dr. Bill Adams. Welcome.
Thanks for having me, Rod.
Hey, it's great. Not only is he an incredible innovator and plastic surgeon, but he also is a world expert on breast surgery and specifically breast augmentation. So, what we thought we'd talk about today is all the things that people think are true about breast augmentation, and they're not. So, what are the 5 myths of breast augmentation? Let's start with the one that I hear about all the time, is that breast implants need to be replaced every 10 years, no matter what. What is that?
Yeah, so then this is such a great topic. We could go on for literally hours, but I know we're going to condense it down to kind of the Cliff Note version for the listeners. But that is such a misnomer, and it's all over the internet. Now we get the internet. It is everybody is getting it all. It's accessing information all over from social media and websites. So it's so much more spread of misinformation. So this is something that dates back. Breast implants have been around since 1962,
right.
And so the original generation implants. Now I think there's 8 generations of implants, but the first couple of generations implants, in particular the second generation, which was very thin wall shelled and very thin silicone gel, were not very durable. And all of those implants by 10 years was leaking and ruptured. But what happened, and so those implants were used in the 80s, 1980s.
Right. And that's where the science came from, right?
Yeah, right. And then it evolved, and so now we're all using generation 4, 5, 6, 7 breast implants. And so the current implants don't need to be replaced every 10 years. In fact, they just need to be followed. And we're following people now with the most modern way to do it, which is ultrasound, not MRI. It used to be MRI. That was the
non-invasive, no radiology, no problems with radiation. Nothing.
Right. Well, and patients hate it. I don't. Have you ever talked to me that had a breast MRI? It's the most miserable thing.
Yes.
Like you have to they lay on a table and hang their breast through this little hole. It's like some children's game that's
terrible.
Yeah, it's terrible, and it's uncomfortable, and you have to lay still, and you can't breathe, and so it wasn't surprising none of the patients did MRIs.
Exactly.
And so finally at the FDA advisory meeting in 2019, the panel actually recommended a drop MRI, but the FDA's finally come through and said we recognize ultrasound as an alternative to implant surveillance. So anyway, back to how long implants last. Now we're doing ultrasounds on all these patients coming back 15, 20 years out. So at 20 years, 95% of the implants are intact, fine. So you just need to follow it, and it's so easy to do via ultrasound. So you don't have to replace the implant every 10 years.
Right.
You just have to have it followed.
Right. That's great advice, and it's simple to do. Now you can either do it like I think you do it in your office, or you can send them for an annual ultrasound. Right. And, and especially if they're after age 40, a woman should always demand an ultrasound with her mammogram.
Yeah.
Right?
And I tell some of the one of the first 3 things I would buy if I was a young surgeon would be an ultrasound, because you can use it for so many different things. But it really is it's a service we provide to our patients, and they really like it, because they come in, they have to go to a radiology center. And actually, Rod, this is another, not a myth thing, but plastic surgeons are actually better suited to read breast implant surveillance. We're not looking at the breast tissue. We're not trying to diagnose breast cancer.
Right.
But plastic surgeons understand. Most radiologists have never even seen a breast implant.
Exactly.
That's like this mythical thing. They saw a picture. They don't know how breast implants behave in the body, how it reacts pathologically. And so plastic surgeons are experts in that. So we have a little leg up in really assessing the breast. And so it's super easy. But patients love it. They love it. They think it's great, and it's very accurate.
Right, and you teach it, right? You teach it at our
we have
national
courses, Aesthetic Society course, and it's great. So, just need to follow the breast implants. They do not need to be replaced every 10 years.
Great advice for our viewers, okay? Know before you go. Okay, Bill, the next one, the Baywatch Look. Everyone needs to have the Baywatch Look?
Yeah, I think and this goes back, who knows, 30, 40, 50 years ago, that there's just everybody that does the breast augmentation is just this vain person that either wants to have big, huge breasts or be Baywatch Look, and that is so far from the truth. In fact, I mean, that is so different than every patient I see in my practice. No, people don't want anybody to necessarily know they had it done, but they're doing it for real life personal reasons.
Same here.
You know, it has nothing to do with having big breasts. You know, every once in a while you have somebody, but those are outliers. You know, they do it because they want to fit better in their clothes. They had children. They want to just restore a little bit of breast volume so they don't have to buy a different bathing suit top from the rest of it. And the unique thing is it's profound, the effects of that procedure on people's lives. And there are different people, you know, people, oh, well, I don't believe in that. They need to come in and see this. And people come in and whether it's just this self-confidence that they gain, it's just amazing. It's really phenomenal, and you know, that's been supported by every quality of life study that's ever been done on breast implants.
Right. No, I agree, and I see that it's much like rhinoplasty. You know, it's not just a cosmetic procedure. It changes. It can be a life changing, and I agree. Yeah. And also, that's the same type of patient I see. You know, they've had kids and they just want the breast to look fuller, but they're not kind of trying to blow it up. And also, it's not good to have super large implants long term, right? It's not good for your body.
Yeah, that's like you know, like I remember back in Thursday conference in our training, like small flat, big problems, like big implants, big problems. Yeah, and it's just not, you know, you need to pick implants that fit the breast, and most of the people that are coming in, you know, we don't see a lot of people like this, but if they're coming in because they think they're going to get a better boyfriend, that's not a good reason to do a breast augmentation.
No.
But that's, again, so few and far between.
I agree.
These people come in, they're so rational. Even, you know, you'll have even people that are fairly young, but they just, you know, actually, women are the best patients because most men can't verbalize things very well. Right. And women, but they say, yeah, it's just, look, I just have this, I just want to have the confidence to buy the clothes I want to wear and feel good in it, and that's why I do it. But then they come back and they're like, you're a different person.
Right. Oh, yeah. Same thing. I know. I agree. And that's the ideal patient.
Yeah.
I agree.
Yeah.
Okay, so breast implants cause cancer. I hear that all. No,
yeah. So that's actually, you know, there's so much chatter about this now. So let's break it down in a couple ways. So the truth is that let's look at breast cancer. Breast cancer, 1 in 8 women gets breast cancer. It's far more common than anything else. Now, there are a couple implant-associated malignancies, and we'll talk about those. But breast cancer is the big one. It's like so much more common.
Of course.
And so in every study, actually, there's some recent ones that have come out. The incidence of breast cancer in women with implants is lower than the general population. And actually, it's significantly lower. And the reason for that is not totally understood, but it's been reproduced over the past 30 or 40 years. And you know, the real question, actually, one of my fellows, Dave Sieber, and I have done some publications. Actually, we published in PRS on, it was something for breast implant associated ALCL. But we're looking at, you know, what really, if you can predict what is the protective effect for breast cancer, and breast cancer is so much more common in women, it could be a significant protective effect when you weigh it against some of these other things. Now, in all fairness, too, there are some newer things that we didn't know about really 10 or 15 years ago. So you have breast implant associated ALCL, that's lymphoma. It is very rare. It's dependent on the type of implant. The data and the real world data really supports it. It's only been seen in textured implants, so it's never really been reported in a smooth only implant. Right. But it really has to do with chronic inflammation, and it has to do with bacteria creating chronic inflammation over time. So the implant is really not necessarily causing the lymphoma. It's more of chronic inflammation because there's more surface area on these textured devices, and that's actually why the macro textured or more textured implants were removed from the market. Right. And so it is still a rare occurrence, but it's something we know about. You know, the good thing about it is it's not great. You know, you don't want to have anybody get any kind of issue like that, but it is treatable if it's diagnosed, usually diagnosed with a seroma around the breast or some abnormality. And the treatment is actually surgical, it's just removing the capsule.
Right.
So that's something that's new. And the other thing, which is, it's not necessarily new, but it's become to light more, is squamous cell cancer. Right. And again,
that's
this
case
is
reports.
Yeah, but it's, again, extremely rare. I mean, there's 50 million women with breast implants worldwide. And again, the data would point to it's almost like a Marjolaine ulcer type thing, chronic inflammation.
Right.
Could be bacteria, could be other things. Marjolaine ulcers were things like radiated wounds, things like that, where there's chronic inflammation over time, and then that it would degenerate into a squamous cell cancer. But again, those things, we participate in a FDA collaborative community, and so we talk to different advocates, and I think that for the most part, they're I think very good and very, very reasonable about things. But sometimes you'll meet some people that are relatively unreasonable, thinking that every breast implant patient should have their capsule taken out because it could have squamous cell cancer in it. And the truth is, it doesn't make any sense, because the numbers don't support that at all.
Right, and the science isn't there. And but getting back to breast cancer and implants, that was shown by multiple studies from the New England Journal on back to the 80s that it doesn't cause that, except for those exceptions that you just mentioned. So,
yeah.
All right, that's number 3. So, okay, and the other one is there's so much recovery and it's painful.
Yeah, the breast implant is extremely painful, and you're in bed for 2 weeks, and that, if it's done certain ways, that's probably true. But things have advanced, just like a lot of things in medicine. We have more quicker recoveries and minimally invasive ways to do things. But with the kind of modern techniques that are done, patients actually can be out shopping the day of surgery. They can go out to dinner. They don't necessarily have to take a lot of pain medicines. There's 2 things patients are worried about in surgery: pain and scarring.
Right.
And so, the pain thing with breast augmentation is something that is really, I think, a thing of the past. Patients really can recover quickly. We generally don't want people to do too much the first couple weeks, especially because they're still got wounds to heal and things like that. But they can get back to their daily routine, drive a car the next day. And it's just, it's like a relatively fun, easy procedure for them.
Right. And really, thanks to, Dr. Adams and John Tibbetts, really they've transformed breast augmentation. It's really, it's unbelievable. And really, that's the standard of care, I think, right now, is the old way of, ripping the muscle, and by doing it very meticulously, methodically. It's been a game changer.
Yeah,
it's unbelievable.
The whole process of breast augmentation, the byproduct of that, not only is the number one byproduct is that it optimizes outcomes for the patient, less complications, better outcomes. But the other byproduct is the recovery. People have much easier, fast track recovery.
Yep, I know it's been a game changer, thanks to you and John Tibbetts. So okay, so what about the surgeon? They're on social media say, hey, anybody can do a breast augmentation. It's a simple procedure. Not.
Yeah, I think that goes back to, for many years, people thought, breast augmentation, it's like the intern can just do it because it's a super simple thing. I think what we found, it's like a lot more complicated than people think, because there's a lot more goes into it than just putting an implant in the pocket. But even that, is a lot more complicated, I think, than originally thought. I mean, again, those are older techniques where people are using blunt, blind dissection and dissecting big, huge pockets and thinking it was going to be fine. But, we talk about this all the time. You always say no before you go, but you need to not only, we start with a board certified plastic surgeon by the American Board of Plastic Surgery, but it also needs to be somebody that has a high level of expertise in doing that procedure, because there's some people that, are doing one breast augmentation a year and they're a board certified plastic surgeon and a good person and probably a good surgeon, but that's probably not who I'd pick to do my breast augmentation.
Right. It gets you in the ballpark. The American Board of Plastic gets you in the ballpark, but it doesn't, just like for rhinoplasty, it doesn't tell you that they're going to be a breast augmentation expert, and you need to have the expertise, the experience, and the ability to show exceptional results.
Yeah, and even more than that, there's many other people out there that are doing surgery. It seems weird to patients, because they
internists,
they go fly in American Airlines and they just accept, and it's true, there's regulated. You have to be a fully licensed pilot and gone through thousands of hours of training to fly an American Airlines plane. But that's just not. It's weird in medicine. it's not regulated because all these antitrust things, and it's actually ridiculous, I think, because patient safety suffers. But there's people that have no surgical training that offer breast augmentation, and unfortunately, it's just how it is when you have things that people pay cash for. You know, you have these people out there that aren't trained that market themselves and they have a really nice looking website, and unless you really do your homework, you may not actually know they're not even a surgeon and weren't trained.
Right.
And that's rampant. There's a lot more people like that out there. They're, you know, whether they're called cosmetic surgeons or what, than plastic surgeons, fully trained plastic surgeons. And so, you know, it could be a problem. You know, if you have somebody doing your surgery and they have no surgical training, they're internists by training.
Right.
That's not going to work out very well.
Yeah, I mean, it's all those incredible added, you know, safety outcomes. You know, you need a board-certified plastic surgeon, but also somebody who really understands the process, operates in an accredited operating room, has all those safety characteristics, have an anesthesiologist or a CRNA that actually is there to do and, you know, to be safe, because, you know, it's real surgery, has real complications. So, wise words from a wise surgeon on breast augmentation myths. This is a must-know. Please send us your comments and thoughts, because know before you go. You got to see an expert like Dr. Bill Adams if you're going to consider any type of breast surgery. Thank you so much.